Hi everyone, my name is Dr. Arpan Patel. I am the founder of Alpha Dental Excellence here in Langhorne, Pennsylvania, and we have been in practice serving the community since 2006. I graduated from the University of Pennsylvania roughly about 14 years ago, and have been practicing dentistry ever since then. I came about into dentistry from a chain of family dentists. My father was the first of them. I recall wanting to be a dentist ever since I was a kid. You know, at the age of 7, I was in his practice playing with dental models, and that's where the love for dentistry began. And as many children would sit there and kind of say, hey, I want to become a fireman, I want to become a police, you know, my situation was started off a little unique, and I always wanted to be a dentist. Some of my hobbies include, playing golf. That's one of my biggest passions. I'm not very good at it, but I love playing golf. I have a beautiful wife who I'm very thankful for, who has put me in this position that I'm in today. The support behind me. I have 2 beautiful, lovely boys. One's 9 and one's 6, and the 6-year-old wants to behave like a 9-year-old. So in essence, I have 2 9-year-olds. But as a parent, it's challenging. You try and balance life with work, and I think I have a great team here, a great support staff that allows me to balance that life and work, and in turn gives me the time and efficiency and energy to kind of, be with my patients and do what I know best, and that is to serve them. So, other than that, my father is no longer with us. He was the heart and soul of my entire foundation, my life. My mother still lives. She's great. She's also in and out. She's a support. I have a brother who is with us as well in the practice. Not a dentist, but he helps out as best as he can, and that's kind of where my personal life lies. I went to undergrad at the University of the Pacific out in the Bay Area, San Francisco. I did 4 years of undergrad there, earned my degree in bachelor's in science in biology. Soon thereafter, I followed in my father's footsteps and went to the same dental school that he went to, which was the University of Pennsylvania right here in Philadelphia. Upon graduation from the School of Dental Medicine in Philadelphia, I went directly under his wing. And that was one of the greatest things that could have ever happened to me, because he was a mentor of mine in every aspect of my life, especially dentistry. And he kind of took a fresh newbie out of dental school, and from day one kind of started putting me in situations and procedures and in patients' needs, serving their needs, where I started out from the first month learning how to do full mouth rehabilitations, not just concentrating on the smaller drilling and filling procedures that they teach you in dental school. So, within the first 6 months of being out of dental school, I picked up right where my father kind of, left me, or kind of picked me up and put me, which was 35 years into dentistry. That kind of put me about 10 to 15 years ahead of my time, my age, my peers, if you may. But just as every dentist would need, every physician should need, every medical professional should need, you never know everything. And you kind of have to learn, and you have to learn, and you have to learn. That's how you better yourself. That's how you kind of take in the knowledge to give to your patients so you can serve them better. I kind of just took it upon myself and got better, at aesthetic skills, at clinical skills. While my father, of course, coached me on people skills, which I think is one of my strong points. In 2008, I kind of embarked on a very special educational journey, which was dental implants. Now it's becoming very popular, but I often sit there and think about it, that before I took this extensive course in dental implantology, my first recommendation for missing teeth for patients were bridges and partial dentures, which was not the best treatments for patients as we know it today. But due to the lack of knowledge, that's kind of all, as a dentist, I could offer to my patient. So part of that lack of knowledge was a driving force that kind of made me go into the implantology field and start learning more about replacing missing teeth, helping patients who suffer with loose dentures kind of make their dentures and lifestyle better with the world of implantology. And since 2008, I have placed hundreds of dental implants, and I feel as though I have done so in fulfilling part of my role